Welcome back to Autism Live. I'm Shannon Penrod, and it is Autism Awareness Month, and in behalf of that, we have asked the wonderful and fabulous Dr. Adel Najdowski to come in and spend a few minutes with us talking specifically about some warning signs of autism. But Dr. Najdowski, you are the Director of Skills, is that correct?
That is correct, at the Center for Autism and Related Disorders.
Well, thank you so much for being here with us. Let's start, first of all, with what is autism?
Well, autism basically is identified as a child having at least 6 symptoms, and they go across 3 categories, including communication and language, social skills, and repetitive or ritualistic behaviors. Now, if a child doesn't have quite 6, they have a little bit less, they would get PDD-NOS. And if a child only has symptoms in the social area and the repetitive behaviors area, they're diagnosed with Asperger's syndrome.
Okay, and that is by the current diagnostic criteria, which we've all heard about in the news a lot, is about to change. How is that going to change in 2013?
Yeah, it's crazy. In 2013, actually in May in San Francisco, they're going to release it at the APA convention, the annual meeting there. And basically, the new diagnosis for the DSM-5 is going to combine the communication and the social areas into one category, and then that category will now be 1, and then there'll be a second category for the ritualistic behaviors.
Okay, so very changes afoot.
Exactly.
And we'll stay tuned here talking about that and having you come back in to tell us more as we learn more about that. But let's talk for a moment about when a family has a child that is failing to make progress. What are the red flags that we need to pay particularly attention to for autism?
Well, actually, at a very young age, even starting around 9 or 10 months old, believe it or not, that young, kids will start to engage in behaviors where they share things with one another. So, for example, if they see something interesting in the environment, they will point at it. If they have a toy that's interesting, they might come and hand it to you or show it to you. But they're definitely making eye contact with you, and they're trying to share an experience with you, even if they're not even engaged in any language yet at that point.
Okay.
Other red flags that are out there is that they may not respond to their name. Some families even say that at one point they thought their child was deaf because they would say their child's name over and over again, and their child would not respond.
Okay.
And oftentimes they got them screened for that and that sort of thing.
Okay, so if you're not seeing those kinds of behaviors, if the child isn't wanting to share things with you as early as 9 months, you need to be concerned about that and seek out some help for that.
Yeah, well, I mean, every child's different. Right. So I would say if you're not seeing that by the age of 1, then you should probably be a little bit concerned. Early diagnosis is possible these days. The average age, actually, though, that children get diagnosed is around 4 years of age in the United States. But it is possible to do it, you know, around 2 years of age, 18 months of age. So, you know, if you see those red flags, just start paying attention to them, essentially.
Absolutely. And so if you start to suspect that it could be autism, if you're seeing some of these red flags, what kinds of things should you do at that point?
You should definitely have your child seen by a specialist. Oftentimes, families will go to their regular pediatricians. They're typically going to say the same thing, usually, which is just wait it out, every child is different. And that is definitely the case. Sometimes people get a little bit overly excited at too young of an age, but if you really want to make sure, the best thing to do is to take your child to someone who is actually an expert in autism and can do diagnosis in that area. So a licensed psychologist, a neurologist. The titles might differ, but I would check the background of that person to make sure that they oftentimes see children for the diagnosis of autism, just to make sure they're a specialist in that area.
Okay. A wonderful thing. And also we should note that those are some of the red flags early on, but if a child at any point shows any kind of regression, is that a red flag as well?
Yeah, if you see that sort of thing, that's something to look into as well. However, I think that with even the new diagnosis, it's really looking to see that there's some sort of this as onset at early childhood. Sometimes people don't notice till later.
Yes.
But you know, if you do have an older child and they are meeting some of the major milestones and everything seems okay, but just a little iffy, some of the things you might notice is just that they don't seem quite altogether socially.
Right.
Like their social behavior just seems off. And they don't seem to like really engage in reciprocal responding with people. When engaging in social interactions, they don't seek out to make social relationships, or they don't have very many. The eye contact will probably be lacking, things like that.
Okay, so any of those things we want to seek out help. Here's the big question that I want to hear from you: is autism treatable?
Yes, autism is definitely treatable. We know that now from many, many years of research. The first study that came out was by Lovas in 1987, and in that study he basically showed that 47% of the children who received intensive ABA-based intervention, applied behavior analysis, for a few years, and intensive was for 40 hours a week. 47% of those children received or achieved normal functioning. So
it's a wonderful amount of hope for all of us to know that it's treatable, and even for the children who weren't in that 47%, they made progress.
Yeah, that's right. So any child who receives ABA-based intervention is going to make progress. But ever since that study, there's been many replications, and so we now have a backing of research basically showing over and over again that ABA is effective, and that if it's done intensively, and if it's started early enough and done for a few years, that a good percentage of kids can actually reach those best optimal outcomes.
Wonderful. So for parents who are watching, if you're seeing some of these red flags, it's better to go in early, because early diagnosis is going to make a big difference. Yeah,
definitely get your child looked at, and you know, a lot of times parents, they have a way of just having this feeling about it, and
the instinct.
Oftentimes there can be correct. So
yes, so keep following up on it. If you're being told not to worry and you're still worried, follow up on it again. Right?
Yep.
Early diagnosis is key. Thank you so much. Wonderful to be hearing these things during Autism Awareness Month. I know that there are many parents who are going to benefit from this information.
Thank you for having me.